Hey guys, Dr. Reeves here for another quick neurology video. Today's video is about back pain that's not a disc and not a pinched nerve. And this is not a comprehensive review of everything that can hurt in the back or the low back, but rather this is my take on a couple of conditions which I think are A, pretty common, B, very commonly missed, C, tend to be chronic and painful and really limit people's ability to move around and to carry things, to bend, to lift, to twist. And then lastly, things that are actually fairly treatable. So I'm just going to cover a couple quick things and then we'll be out of here. Thanks for your attention. So the first area is the SI joint. Now there are two SI joints, one on each side, that go from the kind of this area, they go down a bit. And they can become inflamed. And when the SI joint is painful, people will say, well, I have back pain, but when you poke up in the back area, it doesn't really hurt very much. Instead, if you go down and you go off to one side a little bit, and you poke in there, people say that's very painful. And very often that's because the SI joint itself is inflamed, or sometimes the muscles that are coming down along the spine and attaching here, right kind of at the top of the buttocks area, are inflamed. The second thing, kind of in this area, is that piriformis muscle. Now it's just a little bit lower, and it kind of runs deep from here down towards the hip. And it runs right across that sciatic nerve. And so when the piriformis is hurting, it can irritate the sciatic nerve and send things shooting down the leg. But the key is when you kind of go up, not right over the SI joint, but a little bit lower and a little bit more outside, and you kind of push way up inside here, you'll be able to roll your fingertips across the piriformis muscle. And that can be very, very painful for people who have been running around with back pain. They're treated very differently, of course. Often it may take a cortisone injection into the SI joint. It may take physical therapy, anti-inflammatories. The piriformis is often treated with different kinds of physical therapy. And there are some certain piriformis stretches that are all over the internet and lots of diagrams. And sometimes you have to inject it with cortisone. That's often done under some kind of image guidance, maybe ultrasound, for example. Now, sometimes even pain from the greater trochanteric bursa, which is over here, kind of when people talk about my hip, they're really talking about the greater trochanter of the femur, because the hip bone itself, of course, is deep inside here. But the greater trochanteric bursa lives underneath this tissue here, and when you poke in with your thumb, people will sometimes have quite a lot of pain because that bursa has become inflamed and they have bursitis. Now, yes, they have more hip pain, but sometimes it just sort of coalesces. It hurts on both sides, and so people will say, well, I've got, low back and butt pain, and maybe some of it is the joints in the low back, maybe some of it is an SI joint, but not too rarely some of it's coming from the greater trochanteric bursa areas. So that's just a couple quick hits. When you see somebody who has chronic low back pain, meaning really backside pain, to think not just of the vertebrae, not just of the facet joints in the vertebrae, not just of the pinched nerve, which everybody's always thinking about, oh, it's a pinched nerve, there's a disc bulge, or something like that, but to think about these other common things that occur that cause chronic back pain.